This is My Child Will Thrive, and I'm your host, Tara Hunkin, nutritional therapy practitioner, certified GAPS practitioner, restorative wellness practitioner, and mother. I'm thrilled to share with you the latest information, tips, resources, and tools to help you on the path to recovery for your child with ADHD, autism, sensory processing disorder, or learning disabilities. My own experiences with my daughter, combined with as much training as I can get my hands on, research I can dig into, and conferences I can attend, have helped me to develop systems and tools for parents like you who feel overwhelmed trying to help their children. So sit back as I share another great topic to help you on your journey. A quick disclaimer before we get started. My Child Will Thrive is not a substitute for working with a qualified healthcare practitioner. The information provided on this podcast is not intended to diagnose or treat your child. Please consult your healthcare practitioner before implementing any information or treatments that you have learned about on this podcast. There are many gifted, passionate, and knowledgeable practitioners with hundreds, if not thousands, of hours of study and clinical experience available to help guide you. Part of our goal is to give you the knowledge and tools you'll need to effectively advocate for your child so that you don't blindly implement each new treatment that comes along. No one knows your child better than you. No one knows your child's history like you do or can better judge what is normal or abnormal for your child. The greatest success in recovery comes from the parent being informed and asking the right questions and making the best decisions for their child in coordination with a team of qualified practitioners in different areas of specialty.
Today's podcast is sponsored by the Autism, ADHD, and Sensory Processing Disorder Summit. In order to learn more about the summit and to sign up for free, please go to www.mychildwillthrive.com/summit.
Hi, welcome back to the My Child Will Thrive podcast. I'm Tara Hunkin, and I am really excited to have with me today Dr. Peter Scire. We're going to talk about what you need to know about the CDC changes to the developmental milestones. These are the first changes in almost 20 years, and a number of them have taken people by surprise. Everything from speech language pathologists, occupational therapists, and more are talking about that. I wanted to bring on my go-to expert for all things neurodevelopmental, which is Dr. Scire. If you haven't listened to the podcast or one of the many interviews I've done with Dr. Scire over the years, he's here often. Let me just give you a quick synopsis of his background. Dr. Scire is known as the brain doctor and has examined and treated thousands of children with neurodevelopmental disorders since establishing his first practice in 2005, combined with his 8 years of running his brain balance centers. Dr. Scire received his Doctorate of Chiropractic from Life University in Atlanta and has completed graduate studies in clinical neurology, nutrition, vestibular rehabilitation at the Carrick Institute of Graduate Studies. He's a board-eligible chiropractic neurologist. He's also the past president of the International Association of Functional Neurology and Rehabilitation, and he's a frequent lecturer to healthcare providers, educators, and support groups on functional disconnection syndrome and its applications for adults and children with developmental disorders. Dr. Scire has been co-teaching with his mentor, Dr. Robert Melillo, who's the author of Disconnected Kids, if you haven't heard of that before, since 2008. Dr. Scire currently practices at his private practice, Scire Integrative Health in Noonan, Georgia, where he uses a multimodal approach to neurorehab combined with functional medicine to treat patients around the world. Thank you so much once again for being here.
Thank you for having me. It's always a pleasure to be here.
Yeah. So we're going to dive right into the topic today, which is, as I said before, something that has surprised a number of people in terms of what the changes are. But before we get into those, and we're going to talk about a few of them in particular, I'm just going to give a quick synopsis of what has happened. The CDC back in, I guess it was late January, announced new guidelines. Some of them they've added, some developmental milestones they've removed, but they did this through a panel of what they say, I think there were 8 experts that reviewed research over the number of years of the data that they had been collecting. And the people involved in that process varied, but they did miss some key elements of others that that work with children on a regular basis. And I think that's probably where we're going to see the exceptions in terms of what they've decided, because it takes into research data, but not really the clinical knowledge of the people that are working with the kids on a day-to-day basis. That being said, the basis of what they did was they decided to move the benchmark for whether or not it was when the milestone would happen from, typically it was the average age of when a child would get to that milestone based on the data, to when 75% of the children would actually have attained that milestone. And they said the reasoning behind that was for clarity, so that parents and their healthcare providers wouldn't see so much ambiguity and say, maybe there's a problem, maybe there isn't a problem. If they aren't meeting that milestone by the new milestone dates, they're saying there's definitely a problem, because they're in that bottom 25%. So we'll get into that in just a minute. So that's where we are seeing shifting of milestones that were supposed to be met earlier and now to later. So that's the biggest one. That's one big component of the whole overhaul. And then the second big component is just some milestones being eliminated altogether. And then the third thing they did is they did add some in, and specifically with which we're not going to discuss today, but specifically with respect to milestones that might need to be met, or so people can help identify when a child might be challenged with symptoms of autism. So that's probably a good thing that they're starting to do that. But let's talk about some of these other changes that don't quite hit the mark for a lot of people that are working with kids these days. So let's just start with saying, what are developmental milestones and why are they?
Sure. For me, this was really fascinating when this happened, because I happened to be collaborating with Dr. Malou this past from January to March, and we were getting ready to be in Dallas about a month ago. And my whole part of my presentation for the practitioners that we were teaching were the first 0 to 36-month milestones. So when this hit, and I was in the process of putting the presentation together, this is really eye-opening for all of us, because I think for the better part of almost 20 years now, my whole clinical attitude towards this, and not only mine, but I think the field of developmental neuroscience, the field of developmental neurology, all the disciplinary practitioners that I've worked with in the world of developmental disorders, like your SLPs, your speech language pathologists, or your OTs. The one thing has always been about early, and from a level of understanding where we are now in terms of our diagnostic ability. What we were doing 20 years ago diagnostically to now is quite different. So the ability to, immediately identify when there might be a sign of a developmental immaturity in the brain. Okay. And there's now a belief that we can see this right away. The moment a child is born, there are certain normal developmental steps that the central nervous system goes through. Because when we're talking about an infant, we're talking a child at birth, the context of how you and I or many others would probably describe the brain is really not what the brain looks like anatomically at that moment. Okay. When a child is born, most of the activity of the central nervous system is reflexive. And so we have these different reflexes that we now obviously have been referring to as primitive reflexes. We've known this for decades of neurology. So there are these reflexes that the brain is going through that are at the brainstem level that are allowing for, first and foremost, survival. Okay, and the survival, the initiation of the birthing process, a child being born, and then within those first couple of days of a child being alive. So we have these reflexes that set the stage for further development. And so when you look, and I was going through all the presentation and looking at all the different developmental assessment tools that are out there, a lot of these tools we've known very precisely from what happens from 0 to 3 months, 3 to 6 months, 6 to 9 months, and so on over the first course of 36 months. And this is, and what I was talking to the practitioners about, there was about 5 or 6 major profiles that are used within the arena, whether it's used in private practice from OTs to SLPs to developmental psychologists to even at the school level, 5 or 6 major ones. And I've worked with families internationally, and they're commonly used throughout the world. So I think there's been a consensus that we've all worked from for the last 30, 40 years on what are these developmental steps that happen in the area of sensory development of a child, in the area of motor development of a child, cognitive expectations of a child, emotional and social development. And so all of these aspects, and I literally have one of them right here that is just a little cool little thing coming from the group called the DAYC, the Model. And this is a great way, again, to look at this and say, okay, what are the communication skills of a child throughout that first 24, 36 months of life? So this is definitely, I think, a big slap in the face for most of us that have dedicated our lives to this work, to say, okay, here are these very finite points of development that we can look at, that we've all agreed upon for a better part of 30, 40 years, and we've modified it over time. But these modifications will lead to children, the delay of diagnosis, in our opinion, in that we will look at and say that, hey, we could actually look at 0 to 3 months and 0 to 6 months and really begin to know, is there potential for developmental immaturity? But if parents are being told, no, that's okay, this is now pushed off to 6 months or 9 months or 12 months, we're gonna see an explosion in more developmental disorders.
Yeah, I think that's the most alarming part of it. And I understand the more definitive saying, yep, for sure, you've got a problem there. If they're at the 75% of them have met it at a later milestone. But as I think, and I know, is that just because delayed milestones are a problem too. And from the practice and the work that you do, when kids aren't meeting them at what were the earlier milestones that we had set, you typically are seeing the early signs of a delay that will cascade over time.
Yeah, and I think that's the biggest worry. The biggest worry is the fact that if we don't catch this delay immediately, what are the long-term effects? And especially when we're relating it back to these primitive reflexes, okay? If these primitive reflexes are allowed to, these developmental steps, and not to complicate it, but it's just these automated steps that the nervous system, the central nervous system goes through, that allow us to go from a fetal position developmentally to more of a upright position, and it integrates our eyes, it's integrating our inner ear, our vestibular system with our body, our proprioceptive awareness, if we keep it on a general term. But that's really what the majority of these reflexes allows us to do, is allow us to integrate 3 major parts of our neurology: our visual centers, our visual system, our auditory system, combining that with our proprioceptive system. And so when we look at these reflexes, and if these reflexes are allowed to stick around for longer periods of time, or we're not doing a reflex evaluation on a child, and we're not determining that these reflexes are delayed or present, then yeah, we're gonna miss these subtle signs in neurology. And I think the big thing for parents to understand is that these small developmental differences that can happen magnify at a greater date. And for someone who's evaluated children from birth all the way up to their latter part of their adolescence and into adulthood, it's significant. And it's significant when we look at a developmental milestone at 6 months, what it might look like even 18 months later. And so these are things that are important for us to realize, that we cannot mitigate or minimize the idea of these delays more than anything.
Yeah. So let's talk about a few of them in particular. And I just, before I do that, I just want to mention that for anybody that's interested in actually looking at what the CDC said, there are links in the show notes directly to what they've said. Also to the journal article that is what was published in the Journal of Pediatrics as to how they determine these change milestones. So you can read and judge for yourself in terms of whether or not that was the way they went about doing this made a lot of sense. We also have in those links as well a link to the primitive reflex cheat sheet, that if you aren't as familiar with primitive reflexes as some people are, just so that you can get caught up in some of these terms. But I want to get into some of the milestones that they've moved or removed or changed. I think the biggest one that surprised pretty much everyone was when they removed altogether the milestone of crawling.
Mhm.
Can you explain why this is a very big deal and what the implications of a child not crawling are to their further neurodevelopment?
Sure. With crawling and creeping, again, the idea of lateralization in the brain, the idea of that we develop this sophisticated asymmetry of brain. That's what makes humans so unique, is the relationship of our hemispheres and the differentiation and the lateralization and the specialization of the left hemisphere versus the right hemisphere. Yeah, all that is built on this early development of the brain going through these very specific motor functions, and crawling and creeping was one of those. Okay, the ability of our brain to start developing that integration that begins to exist between these two hemispheres. And one of the things that we looked at early on for many years was the idea that if a child had a delayed crawl, or they skipped the whole crawling development, or more than anything, is if we watched their crawls and they had abnormal crawls. I have, thousands of historical histories on children that I've evaluated, where one of the hallmarks of that was very evident to see was the fact that many of the children would have different aberrancies in their crawling mechanisms, or they would skip it entirely. Okay, and then you look at them and say, okay, now they got language delays, or they have these cognitive deficiencies that are showing up. The crawling and creeping aspect is a maturation of the brain shutting down certain reflexes that occur at that time, that occur between, let's say, 6 months and 9 months and 12 months. Because we go from that early relationship of these primitive reflexes that exist between, let's say, 0 to 12 months. And then in the upper part of 9 to 12 to 15 months, we're developing more sophisticated postural reflex that allow, again, this idea of this integration that exists between your proprioceptive system, your muscles and your joints and your ligaments, hardwired into your vestibular system, which is allowing you to know where you are in space and time, and then your visual system, okay? Looking at the development of how your eyes are tracking and moving to the environment. And then once your eyes arrive to what they're looking at, the processing of that. So when we do a complex movement like creeping and crawling, it allows for that integration of those areas. And again, the idea that we were able to see so many kids that had various developmental diagnoses, when you went back and looked at that sign, and even for patients that would bring me their, or parents that would bring me their child when they were 15 or 18 years old, or 20 some odd years old. And we have a developmental neurology history form that we have families fill out. It was always fascinating when you looked at the fact that they was very clear milestones that they missed in that first 12 months of life to 24 months of life. Then you go, huh? And then parents would go, okay, yeah, by the time our child was 2, 2.5, 3, we saw dramatic developmental delays.
Mm-hmm. Yeah. And I think that's what, for people that aren't as familiar, they don't realize that these motor skills, or in this case, it's an integration of both the motor skills and obviously the vestibular and the ocular system all together, that impacts higher function in the long term. And that's the part that I think a lot of people will, they just think if a child doesn't crawl, but they walk early, they're advanced. But the impact of that is not, it's not that transparent.
Yeah. And I think it's really important that everyone understands that the brain is an organ that is dependent upon sensory input at birth. Okay. Or even in the idea that the brain receives its sensory bombardment from the visual system. Okay, the auditory system, the vestibular system, the nerve, the cranial nerve that's coming from the inner ear is carrying two important parts. It's carrying auditory input and vestibular input. Okay, then you have your sense of smell, your sense of taste. Okay, combine that with then your muscle system. Okay, brain is firing, your sensory system is getting stimulated by the environment. Okay, through these systems then transmit input into the brainstem and input into the upper parts of the brain called your midbrain. And then from there, these sensory inputs hit our relay center in our brain called our thalamus. And then our thalamus have all these little hubs in them, these little nuclei, we call them. And from there, they then send that information to very specific regions of the brain. Now, here's the trick. The trick is that those particular areas that we may hear about, like the frontal lobe or the parietal lobe or the temporal lobe or the occipital lobe, the four major lobes of the brain, they do not develop unless there are sensory drive to those areas. Okay, those areas don't develop that very specific lateralization, that very specific specialization that we have as humans if we don't sensory drive that. So that's the problem here. The problem is that we won't receive that sensory input. The child creeping and crawling on their arms and learning how to create that cross-lateral aspect, we're probably going to see very dramatic delays in the differentiation of the hemispheres, okay? Because what happens developmentally is that the brain has to go through these stages of where we sensory drive the brain, we activate these pathways, they go up into the higher centers of the brain, and you have the right frontal lobe, parietal lobe, the right occipital lobe, the right temporal lobe, but then you have it on the left side of the brain. And so they're firing independently. The two hemispheres are firing very independently for the first several years of life. And then as we begin to move developmentally and get more complex, we start getting our networks to link up between the two hemispheres, and we get this bias of our brain. And so that's what's not going to happen, is that if we don't allow for this normal sensory motor development trajectory to happen that we've seen now for many decades, we won't see this complexity of functionality happen, in my opinion. So
yeah, no, I know. So it is fascinating to understand that better. So a couple of the other things that changes. So walking now moved to 18 months. What do you see is the problem with waiting to see if the child walks till 18 months?
Again, so now we're looking at another window of a 6-month to 8-month window. And again, the idea that a child could have been able to start maybe walking, depending on the whole aspect of walking, was looking at when did that creeping and crawling phase happen. Okay, in some children, it happened maybe around that 7th, 8th, 9th month of life. And then from 9 to 12 months of life, walking became more of a milestone. For the most part, we never, we always looked at delayed walking maybe around 13, 14 months of life. Okay, but now to go a year and a half, again, it's going to allow us to miss some key milestones that are happening in those moments. And for me, it always goes back to where if a parent has now said, okay, my child's not walking by 18 months, but would they've gone to their practitioners and been able to catch some of the other milestones that were missing, okay? Because they're looking at the big milestone, because most people are looking at that really big milestone, which is the walking milestone, then combined with the language milestone, okay? So those have been the two most milestones, unless there was just such a glaring delay that a parent would pick up, maybe like my child's not making eye contact or my child's not babbling. But unless there was some really true big evident one, most people are like, okay, once I went for my first wellness checkup or whatever, I really don't go back that often as much as I would normally do. And so, I think that's a big thing, because again, when you look at the fact that what helps drive the lateralization of the human brain is bipedalism. Okay, Dr. Muller's written textbooks on this. Okay, the idea that what allows the human brain to create this specificity that we see in the hemispheres is the idea of walking, and then once we're upright, what the complexity of our motor system. That's definitely going to lead to, again, the fact that we're going to miss many of these developmental delays.
Yeah, actually, it's a really good point. When you get rid of you skip the creeping crawling milestone altogether, and you push back the walking milestone, you're right, there's a huge gap the red flags because they think it's okay for it not to happen by then. And there's so much that could be done. And the beauty of it is, as I know, and again, I have also linked to the response from the speech language pathologist. We're going to talk about the change in the speech milestones in a moment, but they also have a link on their website to all the evidence about early intervention. So how important that early intervention is and getting that done, because they were pretty taken aback as well. So let's talk about the change in the speech milestones, because as you mentioned, that's really the other one that we're always looking for as parents. So the CDC suggested that has now moved a child speaking 50 words, which used to be at 24 months, they've moved it to 30 months. And so that's a huge jump. But at the same time, they've left the milestone of speaking 2-word phrases to 24 months. And as the speech language pathologists have been pointing out, is that in order to speak 2-word phrases, typically children need to be speaking 50 to 60 words. So it's not really congruent with reality in terms of how these things play out clinically. So what are your thoughts on the speech milestones, and what are the things earlier that really drive speech development?
Sure. First, just as I was pointing out earlier about our little cheat sheet we have here, but 18 to 24 months, it was expected that 50 words, okay, the child says, but then really more than anything, the child actually understands over almost 300 words, okay? And this information has gone back for many years, and a child should be able to, like you said, combine 2-word phrases, use commands such as move, possessives like mine or reacts, have reactive words. So yeah, I think that what you're going to see here is, once again, that we're going to look at a milestone that the parents are going to go, well, that's okay. They're within that normative range of what, everybody's saying, okay, this is okay. But in reality, when we don't have verbal development of the brain, okay, verbal language of the brain, we have to begin to look at what was happening in the nonverbal aspect of the brain, okay? Because though we speak as humans, much of how we truly communicate is in the nonverbal language. Did we miss signs developmentally because we weren't looking at some of these other developmental delays to say, okay, we have a language delay in nonverbal communication? Because especially in the world of where we think a child may be on the autism spectrum, okay? Because really what makes autism so unique is that all the cases of autism is really divided by the nonverbal communication problem. Most people probably think of autism and say, okay, a child isn't speaking, but actually in autism, majority of autistic children or adults actually speak, and they speak very well. They actually have what we call hyperlexia. They develop a very sophisticated verbal language early on. So I think that's another sign, is that, are we looking for the nonverbal language piece? Okay, are we looking for the idea that the child is making eye contact? Are they responding to nonverbal gestures of eye contact or facial expressions, or are they making them facial expressions on their own? So these are things that go back into that early onset of development, from that 0 to the 9-month window of saying, okay, I'm seeing signs, because if I saw those signs then yeah, there's a great idea that there would be a delay at, say, 12 months or 16 months or 18 months or 24 months. But why wait for that moment to go, okay, now it's 24 months old and my child doesn't have 50 words. Okay.
Yeah, it is amazing to me as a parent of a child that had a significant speech delay. And at 24 months is when we were previous to that, but the red flag started to and I am very grateful for that, because and the speech language pathologist that we worked with early on, even though we were going through different public services, I just asked, if it was your child, what would you do? And she said, you don't you don't wait.
Yeah.
You just don't wait. There's so much you can do early on that will make it easier for your child as well, because when they have an expressive delay, like you said, a lot of it's also about what they understand. So they can have an expressive delay, but not be delayed in terms of their comprehension. Like they completely understand everything you're saying to them, but they can't express themselves. And it's incredibly frustrating to them when they're like that as well. It is a little more than a little disconcerting that parents may get the impression they're supposed to wait. Now, to be clear, I have read all the different reactions. And of course, the CDC's responded to the speech language pathologists, and everybody's gone back and forth because there was so much upset about it. They're saying that they're not telling people to wait and they don't have to wait and to get services. The problem is that the communication, people say the CDC says these are the milestones. Most parents are going to interpret it as there's nothing to worry about unless they don't hit the new standard for the milestone. So I think that's what's disheartening right now, when at a time when we are seeing an increasing rate in all types of neurodevelopmental challenges. I don't think this is going to help us much at all.
And it's and what's fascinating to me, it always reminds me of when we're looking at like blood labs and we normalize a blood lab. Okay, everybody thinks that there is these normal lab numbers, and the reality, a lot of these lab numbers are based on population norms. And so as populations throughout the world have gotten actually sicker, we've changed the criteria of labs based on population norms, as opposed to what is actually truly a functional norm or a developmental norm. And I think that's coming from some of my education being in the functional medicine world. This kind of really looks at it from that angle where, okay, how I may interpret blood glucose from my perspective in a functional relationship versus a lab relationship. And I think that's the important thing here, is that when we look at the brain, again, we can expand on these topics, but for the purpose of this conversation right now is let's just keep it very simple in that the brain is a sensory organ. The brain is going to receive this sensory input from their senses, drive that into the lower structures of the brain. What I mean by that is being the brainstem, and then the little brain being the cerebellum. And from there, these particular parts of the brain are then going to then start forming the connections into the midbrain. And then the midbrain is then going to start forming the connections into the higher part of the brain called the cerebral cortex, where the lobes of the brain live. Okay. And what we're looking at from a developmental level is to say, okay, are we getting that sensory drive into the brain? Because if we are, great, and then we should see the corresponding motor relationships that happen. Okay. And what we've known for many years now is that these motor developmental steps happen at these key junctures. But if for some odd reason the child's sensory system wasn't developing, well, one of the hallmarks to be able to see that would be the inadequacy or the deficit within the motor system. Okay, because for especially an infant, and especially for a child that isn't speaking over that first 16, 18 months of life, the best way to assess the child is through their motor responses of their neurology. Okay, do they have a retained Babinski reflex when we stroke their foot? Do they have a retained rooting reflex when we stroke their mouth? Do they have a retained 18R reflex? These primitive reflexes, if they're there, then we know that there is immaturity in the brain and that the brain is not going through this normal stair-stepping response that happens. So yeah, this is going to be a thing I think we're going to have to overcome as a group of practitioners and parents, to make sure that we're constantly saying, no, we're going to get these evaluations done at these very key junctures and look at this information.
Yeah. And I think one of the keys here for the parents that are here is that you have to go with your gut. No one knows your child better than you. And if you are worried, it is worth pushing through, because even if you do early intervention and they didn't need it, it's still going to benefit them. It's not going to hurt them. But it's very likely that if you think there's something that's off, that you are accurate in your assessment of your child. What we're really fortunate about is we are going to dive into this topic even further. Dr. Scire has agreed to do an expert masterclass It's called Milestones Matter, how developmental milestones from birth to 3 years old influence brain development, and what you can do when a milestone is missed, skipped, or delayed. The masterclass is going to go live for free, so you can sign up for free. It'll be Wednesday, September 21st, noon Eastern. There'll be a link in the show notes to this episode, so you can sign up there. During the masterclass, you're going to learn what are the developmental milestones and how they provide insight into understanding what treatments and therapies are right for your child, how missed, skipped, or delayed developmental milestones impact the neural development of the two hemispheres of your child's brain, and how this explains their symptoms, what tools are commonly used to assess your child's neural development, and how they translate into what your next steps are to help your child, and why functional medicine and nutritional interventions on their own will often lead to temporary improvements, and how combining them with neuro rehab is essential for long-term success. So I am very excited about doing that. And if you sign up and join us live at that event, you'll be able to also ask questions of Dr. Scire. So come with your questions in hand. It'll be held on Zoom. You can join us for that. And again, I want to thank you for doing this with us today and coming back to do that masterclass. This information is so incredibly important and near and dear to my heart. So I really appreciate all the time and energy that you've given to us here today and in a little bit when we join you again.
Thank you so much.
And so if you're interested in that masterclass, make sure that you check out the link in the show notes. And I look forward to seeing you all there. Bye for now.
So that's a wrap. Thanks for joining me this week on My Child Will Thrive. I'm so passionate about giving you the tools and information you need to help your child recover. And as they say, it takes a village, so join us in the My Child Will Thrive Village Facebook group, where you can meet like-minded parents and stay up to date on everything we have going on at My Child Will Thrive. This is Tara Hunkin, and I'll catch you on the next podcast or over at milechildwillthrive.com.